massage school, physical therapy school, narrative medicine at Columbia. I've been in this business for a long time. I want to create a company that is an agent of change for the 21st century in healthcare. We're a large office. We've been around for 15 years. We are affiliated with NYU, Hospital for Joint Diseases, Hospital for Special Surgery. We are a mainstream traditional physical therapy, very skillful orthopedic setting. I think it would be kind of miraculous to go to physical therapy and have someone there where you felt safe and they were vetted and the person was able to co-treat you with acupuncture, with your physical therapist, and use essential oils, and you do energy work or whatever. I want to have a truly integrative office. What does that mean? In a truly integrative setting, it's all happening at the same time. And that, I think, has never been done before. It's only going to work if we truly collaborate and work together. We're integrating all these approaches. We're collaborating as a team together. And the team includes the patient. The patient is the center of the team. And that part is the narrative part, the story. And the story, the humanity of it all, is really what's gotten lost in medicine in general. Creating this model has been a process. It's been an enjoyable process, but it takes time. And when it's all done and everyone thinks the same way, it's going to seem like, why was that a big deal? Patients want it and they deserve it. And that's why it's going to work.
Acupuncture is good for anyone. It's good for kids, it's good for adults, as long as it's performed by a licensed practitioner. There are no serious side effects to acupuncture, and that's the beauty of it. So overall, acupuncture can be used on anyone, for anyone, any condition. Generally, needles are painless. The needles themselves are very thin. They're actually the size of the hair. And they're not like the ones that are used for injections in a way that they're not hollow inside. You might feel a slight tapping sensation and when a needle goes in, but once a needle is in, you're not really feeling much. It's been really amazing working with physical therapists. The beauty of it is that we actually talk and we collaborate and we get to exchange ideas, and as a result, a patient is a real winner because they're getting a treatment from different angles and they're getting the best care possible because they're not just getting acupuncture and they're not just getting physical therapy, but they're getting a combined treatment.
Most of us move automatically in autopilot mode, so when we lift our arms, we tend to use only a small part of ourselves to lift our arms, but the more skilled athletes and dancers automatically know how to use the ground to generate the force and to allow the appropriate muscles to lengthen and the other muscles to shorten. And Feldenkrais himself was a martial artist as well as a scientist who had his own experience with injuries, and he developed this method using mindfulness and awareness of self to learn efficient movement and learn options for movement. Feldenkrais uses a term called organization. So if a body is well organized, then it will have efficient movement. Feldenkrais is really very internal, it's very experiential, and there is no one perfect posture. There's no one perfect way to use your core. It's different for every single person. So I think the only rule would be if you're comfortable with what you're doing it correctly.
Your pelvic floor muscles, sometimes they can be tight, sometimes they can be painful, and it's an important group of muscles because they actually form a sling from your pubic bone to your tailbone, which help to suspend your internal organs as well as helping you control bladder, bowel, and sexual function. So it's a very important part of our body, and there are many things that can go wrong in that area. So for example, when your bladder fills with urine, in order for you to urinate, your pelvic floor muscles actually have to relax. If someone has very tight pelvic floor muscles, that's going to make that bodily function very difficult for them. Most people, when they hear about pelvic floor dysfunction, they really are thinking that it's more geared for women. But actually, 1 in 5 Americans, both male, female, even children, will have pelvic floor dysfunction sometime in their lives.
Hand therapy is the art and science of rehabilitation of the upper limb. which includes the hand, wrist, elbow, and shoulder girdle. Some of the conditions that are treated include tendon and nerve injuries, fractures, dislocations and sprains, sports injuries, rheumatoid arthritis, and a host of other ailments. A certified hand therapist is an occupational or physical therapist and has a minimum of 5 years of clinical experience. Shift has 2 certified hand therapists that really know what they're doing. A CHT compared to a staff-level PT or OT is a world of difference. If you have a hand injury or have had hand surgery, then you definitely need a certified hand therapist. The hand is very specialized work, and your average PT or OT is typically not qualified to handle complicated tendon repairs or make custom-made splints. It requires years of specific experience and knowledge.
So we're going to stand up. Just use your normal posture. I just want to see what your alignment is like. Come up to a balance and hold, okay? Left foot, good. Hands on top of your head. Good. Just hold it. It's good, your balance is good. Okay, switch. It's a little shakier on that left side. You feel that? Okay. Let's see how you're moving there. It's pretty tight on this side.
Depending on
Ooh, this is tight.
what I have going on. Like I never do the same type of dancing every day, every week.
Okay.
So it's like my body doesn't really get used to one style.
So you've got a lot of movement in your kneecap.
I hear that a lot. I don't know what to do about that.
Well, it is what it is. You know, a lot of people, especially dancers, they just have lax joints.
Mm-hmm.
So what it means for you is you just have to be extra strong to sort of make up for that laxity. Okay, hold that there. Ready? Don't let me push you down. Good, nice and strong. Keeping your knee bent, you're gonna lift your thigh up off the table. Hold that there. Not as strong. So you feel the difference? I couldn't break you on the other one. Mm-hmm. Hold that there, don't let me push you down. Nice and strong. Okay, so this side I can't really break you. The other side I could, right? Let's talk about what's going on. So basically what's happening is this leg, basically the whole side is just significantly weaker than the right, especially up at the hip. So why that's important for you, especially if you're dancing, doing a lot of fitness activities, is if you're squatting like this, remember your single leg squat on that left side was sort of shaky, your balance wasn't very good, you're in and out like this, that's all coming from the hip. If you can stabilize from the hip, so if I'm here, right? From my hip, I can bring it out, so now that I'm there, it's nice and stable. Okay. That way, your kneecap is going to be tracking in the groove the way that it's supposed to, as opposed to getting pulled out to the side or wiggling around like this. Right. At which point, it's going to basically rub underneath. So if you have like a kneecap that's tracking, right? Mm-hmm. And it's rubbing like that, it gets irritated underneath. Whereas if it's just going nice and smoothly, it glides nicely, you don't have any problems. Gotcha. So what we want to do is, first of all, take care of some of your soft tissue restrictions. Your calves are super tight. Your IT band actually feels okay, so keep foam rolling it. Your hamstrings are good. Your glutes were a little bit tight. Okay. So we're going to take care of that and just strengthen up that left side.